We have our fourth speaker in today's first session, and I'd like to introduce her now. She is Kristen Mello. Kristen has a bachelor's degree in chemistry and a master's degree in analytical chemistry, specializing in chemometrics. She is the director of the Westfield Residents Advocating for Themselves, also known as RAFT, a community group formed in response to the PFAS contamination of their drinking water. Kristen led the effort to get PFAS blood testing for Westfield residents. She was a founding member of the National PFAS Contamination Coalition in 2017 and is one of only 2 community representatives invited to be on the Mass Department of Environmental Protection PFAS MCL stakeholder group. Kristen has regularly met with Mass DEP, the EEA, the EPA, and the Massachusetts and federal legislators regarding Westfield's water contamination, and has voiced residents' concern at city meetings, including those of the Planning Board, City Council, the Water Commission, the Conservation Commission, and the Board of Health. Her PFAS advocacy work, in large part, led to her being selected as a counselor at large in Westfield in 2019. And I'm going to turn the meeting over to you at this time, Kristen.
Thank you, Dr. Wolf. And while I am a seated city councilor at large in the city of Westfield, I speak for myself as the director of RAFT and as a PFAS impacted community member, not for the city of Westfield, just saying. And thank you to the National Academies, committee members and staff members for holding this town hall and on this World Health Day 2021. Thank you to the community liaisons for sharing your stories and for all the work you do in your communities. Thank you to the moderators for the work you do today and every day. And if you'll indulge me in a personal moment, special thanks to Drs. Shader and Birnbaum, who will be up later, whose work RAFT uses regularly to help educate our community members. I'd also like to take a moment to thank Mass DEP, the Department of Environmental Protection, without whom Westfield residents would be in the dark about our PFAS exposure. And to the Agency for Toxic Substances and Disease Registry, ATSDR, for requesting this study and for all the work they are doing in the PFAS exposure assessment and health study communities. Not only are they activated because of COVID-19, because they are in the public health service, but they are overloaded with PFAS requests and doing the best that they can. So thank you. Sometimes when we affected community members participate in this type of thing, people speak down to us about our fears and our concerns. Instead of asking for our experience, evidence, and recommendations, it forces us to compete against other contaminated communities for resources and time. It forces us to justify our pleas for PFAS assessment, remediation, and support. And I really want to thank the National Academy staff members who've been working with us for being sensitive to those issues and for actively working to be inclusive during this process. It really does mean a lot. To set the stage for my remarks, I just want to remind everybody that we're told that 99% of Americans have PFAS in their bodies. Even the polar bears have PFAS in their bodies. We don't know even the tiniest fraction of the PFAS out there. My North Carolina people coming up later can confirm that at the EPA's North Carolina Community Engagement event on PFAS, their slide said that there was on the order of 10,000 PFAS. So the 9 included in this study is tiny, not enough, right? And it's what you have, so I get that you're stuck there, but it's 9 out of 10,000. So we need to keep this in perspective. For most of those PFAS, we don't know their toxicity, the toxicity in mixtures. We don't know their health effects. We don't know, with the tox information that we do know, we don't know that the dose response curve is linear or what shape that might be and how it changes for different compounds and in different mixtures. So right at this moment, anyone listening to me, they could be worse off than us. Any one of you could have more PFAS in your body than any of the speakers today, and you might not even know it yet. So I just want you to hear my words with the thought in your head. that maybe you can think about what your family, what you would need if you found out that you were contaminated. My name is Kristen Mello, and I live in Westfield, Massachusetts, and I'm the director and co-founder of Westfield Residents Advocating for Themselves. I was born here, raised here, went away to college and grad school, came back after. In the fall of 2016, I was helping my brother raise his daughters when we found out that our water was contaminated with per- and polyfluoroalkyl substances. One of my nieces at the time was a formula-fed only infant, and because of previous boiled water orders we'd had in the city, we boiled the water we used for her bottles just to be safe. Unfortunately for us, boiling that water concentrated the PFAS we'd been giving her, and that is how a chemist became an activist. So with a data-driven background, I started finding out everything I could. I was told that Barnes Air National Guard Base, home of the 104th Fighter Wing, was the same base that my father retired from as lieutenant colonel, that was the point source for our PFAS contamination from years of fire training with aqueous film forming foam. Our city of Westfield is divided roughly in half, north and south, by a river, the Westfield River. All of our north side municipal drinking water wells are contaminated with PFAS. And we have a few environmental justice communities in our city. So while I could have protected my family by installing a reverse osmosis system and for cooking and drinking, there were a lot of people in our community who could not do that or were not even aware of the problem or the danger. So instead, in my living room on a February night in 2017, RAFT formed as a response to the contamination and aimed at education and advocacy in our community. We lobbied really hard for Westfield to be included as one of the PFAS exposure assessment sites conducted by the ATSDR. In September 2019, ATSDR took the blood of 459 Westfield residents. 92% of participants had higher PFAS levels in their blood serum of at least one PFAS tested than the average American. It's from this background and this history that I give you this information. So we were asked as community liaisons what challenges we have had with our medical providers in dealing with PFAS exposure. And the challenge is that there's just no helpful information. There are studies about things that happen to other people, and there are studies, for animals, and there's this large document from ATSDR that has excellent scientific references and information and whitewashed narrative. And when that first came out, ATSDR certainly did hear from me about that. We're not collecting the data. And so this is a chicken and an egg thing. If you don't collect the data, you can't search through the data and through the health effects, and therefore you can't find actionable information when you take new data on new people. And so this whole situation is inconclusive by design. So our medical providers have a lack of information, they have a lack of guidance, they have a whole lot of whitewashing that they're facing, as well as us. And we don't have far to move here until we lift the veil. And lifting the veil requires collecting the data. So the value of testing people for PFAS exposure, testing individuals when you don't have actionable clinical information to tell them once you get your results, it treats crime victims, which we are, like the trespass of these chemicals into our bodies is something that we respect enough to quantify when asked to. You don't have a problem getting an insurance assessor when your car is hit. You don't have a problem getting an insurance assessor when you have a tornado, but this slow motion, unfolding environmental and public health disaster that was intentionally let happen over years and years and years because toxicity information was available when I was born. It's intentionally keeping the information from us so that we cannot take action. What is the public health value of knowing which people are more susceptible to more negative outcomes from COVID-19? How much information and scientific understanding are you losing by not testing these people who are asking for it? Yogi Berra, the patron saint of chemometrics, said you can observe a lot by just watching. The pharmacy databases already know what members of these communities are diagnosed with. We don't need to reinvent the wheel. We just need to look at the data we already have. Don't avoid taking our data and then complain about data gaps. It's a bad look. Don't do it. When preparing our proposal for the ATSDR's multi-site health study, we asked affected residents about health conditions experienced by community members that they suspected might be related to their PFAS exposure. Lucky you. Here are their answers. Allergies, autoimmune and immune disorders, asthma and pulmonary issues, colon diseases including IBS, IBD, Crohn's, and colitis. I'll give you a copy of this. Reproductive cancers in women, diabetes and other metabolic disorders, thyroid diseases and thyroid surgeries, cholesterol and liver diseases, osteoarthritis and osteoporosis, cognitive and developmental disorders, infertility and endometriosis, neurological issues, brain tumors, kidney diseases, and bladder cancer. Other routes of exposure for our community include food, which we're trying to get tested. We've got some bills in the Massachusetts legislature aimed at that. Air from both industrial sources and landfill flares, it turns out. Yay. Consumer products and packaging, which we all know, and we are concerned about dermal and inhalation exposure during showers. Really, no community is unaffected, and the work you're doing couldn't be more important. So with under 2 minutes left, my take-home messages are: support exposure reduction. The only way to reduce our toxic burden is to reduce our exposure. Respect the violation. You don't treat other crime victims this way. We have a right to clean water, and we have a right not to be trespassed by other people's chemicals that they make billions of dollars on. Those who ask to be tested should be tested, and those who profit from these chemistries should be footing the bill. Collect the data voluntarily and equitably. Use what you already know for your treatment plans. Talk to Laurel Shader. She has an excellent slide about this. Add PFAS testing if the patient asks. We need fully informed consent for any and all testing and treatment. We shouldn't be chasing down rabbit holes that injure people and cost them thousands of dollars if the end result is something they don't want to know or don't want to take action on. We need informed consent, and we, the patients, need to be making the choices. We want current assessment for all, future monitoring, and an opt-in national database for all of this so that the information can be stored and any epidemiological PhD student can go and search for something. We have the technology to take care of this. I sincerely hope that you will advise the CDC and ATSDR to do so. Thank you so much for my time. Thank you so much for doing this.